a cavity in your milk tooth, do you need to treat them? Hi everyone, welcome back to my channel. So if you're seeing the children around you, your own child or somebody else's child who's having a cavity on their milk tooth, yes, it's absolutely necessary that you treat them. If it's a very small cavity, then you need to get a filling done, and that's the most easiest way to treat them. Please don't ignore just thinking that anyways the tooth is going to fall off, then why do you need to get a treatment done? The tooth which needs the filling, it totally depends. Like for example, you are having a molar tooth which is actually having a decay, a molar milk tooth, and then you wait for the permanent tooth to erupt, and you ignore this tooth completely. What are the problems that can happen because of that? The cavity, in case of children, they spread very fast, super fast, not like in adults. So what will happen is if you leave it like that, it's going to spread onto the adjacent teeth. And along with that, just imagine that you find out a decay which is when the child is around 5 to 6 years of age. And the tooth that's going to fall off will be at around maybe 8 to 12 years of age. So just see the gap. If the cavity is noticed some 6 years back, don't you think that's a very long wait when it comes to a cavity which can spread so fast? The tooth is going to fall off so many years later. So that's not the way to do it. And if you wait like that, it can also spread to the adjacent tooth. And sometimes the infection, the decay becomes so large that it can affect the nerve. And once it affects the nerves, then you cannot have a regular filling done. You will end up in having a root canal for the milk tooth, or else you will have to remove the tooth. Do you really want to make your child go through all that? Just think, doing a filling, isn't that much easier, and then making the patient wait, have pain, have infection, and then end up in having something called as a root canal, which is for a child it's very scary. So why go through all that? In the initial stages, if you find out a cavity, the best way, even financially for you, would be to get a filling done. The cost of that is also much less when you compare it with the root canal or the extraction. And if you remove a tooth, then for a very long time, the space over there will be having nothing. So if you're leaving it like that and the next tooth is going to erupt after a very long time, the tooth adjacent to, they are going to start moving here and there, and the space that is required for the new tooth to come, it has to be maintained. So if you are removing your tooth, then you'll have to use a space maintainer in case of the child. And you know what's the worst part? The tooth underneath, that is a permanent tooth which is going to last for your child for a very long time. That tooth can also get affected because of the decay in the milk tooth. The milk tooth decay will spread underneath, it can affect the nerve, and the tooth, the permanent tooth which is below that, it can affect that also. Now, you need to decide which one is the best thing, the best treatment that you can give for your child. So, if your periodontist is asking you to get a filling done, that means yes, you have to get it done. It's very rare that, for example, if you're having a very small cavity and the child is around 12 years of age and the tooth is almost about to fall, maybe that can be one of the cases where you need not get a filling done. But that's very rare. Most of the time, doing a filling is mandatory even if it's a milk tooth. And trying to avoid pain, discomfort, infection which can happen, which can even lead to a hospitalization of the child if the infection spreads too much. So why do you want to get into all that? Isn't it much easier that you treat it at a very early stage itself? No dentist is actually wanting to make money by playing with a kid's tooth. Our intention is just to protect the teeth so that the child will have a good set of teeth for lifelong. So all you parents out there, remember that treating a milk tooth is equally important like how you treat a permanent tooth. And that's all for now. Thank you.